Good morning. My name is Carmen Fong, and I'm a colorectal surgeon at Mount Sinai Hospital in New York City. Today, I'll be presenting an abstract titled Majority of Patients Undergoing Colorectal Cancer Resection from 2010 to 2018 Have Not Participated in Colorectal Screening Programs. I'll be minimizing my video. First, a little background. In the last decade, the incidence of colorectal cancer in patients under 50 years of age has increased despite a decline in overall colorectal cancer incidence. Some prior studies have shown that patients less than 50 years old are more likely to present with colorectal cancer symptoms and advanced tumors at the time of diagnosis. The aim of this study is to use a tissue database from Stony Brook University to compare age at diagnosis, race, ethnicity, associated factors, and survival outcomes in colorectal cancer individuals with symptomatic versus asymptomatic presentations. The methods are that we collected data between 2010 to 2018. This was a prospective tissue database, and the data was collected in REDCap. First, the patient was consented and filled out a questionnaire. The surgical remnant tissue underwent pathology examination. And then the REDCap database was used to extract data for statistical analysis. The subjects at high risk for colorectal cancer were excluded, so this included patients with familial syndromes or inflammatory bowel disease. And then the following three categories of patients were compared: symptomatic on diagnosis with no previous screening, asymptomatic on diagnosis, and then interval or symptomatic, but they had been screened. What we found was that 70% of colorectal cancer patients who needed surgery were symptomatic and had not been screened. 13% had interval cancers. 13% of our patients were younger than 50. Symptomatic presentation was associated with worse survival and advanced stage at diagnosis. Overall, young men and the Hispanic population are more likely to be diagnosed with early onset colorectal cancer compared to non-Hispanic whites. Future directions indicate that there are at-risk populations who have not benefited from colorectal cancer screening, and more research needs to be done to address this. For example, utilization of a screening method such as fecal immunochemistry testing may be easier to access and have better patient compliance, but this remains to be evaluated. For any questions, my email is in the right lower hand corner, and there is QR code there as well. Thank you for your time.